as we speak about our business and our products. So from wherever you are joining us, whether you are here on our continent of Africa or further afield, I would like to introduce myself. My name is Betty OLOO, a long-time Neolife distributor, and it always gives me great pleasure to be able to spend this time with you speaking about our products. I assume some of you might be very new, so just relax and spend the next hour with us. As you know, if maybe you have a question that you'd like to be answered urgently, you can send a direct message to us. And also, just in case I forget later on, just to let you know that next Thursday, being the beginning of the Easter weekend, we shall not have a training session because we shall be participating in our church services. So we shall miss you next Thursday, but of course, God willing, the following one will be back. But coming to today's session, as you might have seen in your invite, we are once again doing a Q&A. We have got quite a number of questions to go through, and especially since we shall not be meeting next week, I was hoping to be able to go through as many of them as possible, hopefully all of them. So here we go. The first question that I have here, someone wanted to know what to do or recommend for recurrent carbuncles. So carbuncles are clusters of boils. I think the common word we use is boils. So sometimes it may be just one boil, but sometimes they occur in a cluster, and then it's referred to as a carbuncle. So one of the reasons for this could be that a person is more, some people tend to be more susceptible to skin infections because boils are skin infections that come about from bacteria that normally are found on the surface of the skin. And when our immune system is a bit weakened, this bacteria can take advantage and cause infections in the hair follicles or in the pores of our skins. Another thing that can make you susceptible to this is type 2 diabetes. Also, if you are obese, this can be an issue. And also, if you tend to have other skin problems, it may make you more likely to have these clusters of boils. So as the person has said, it is recurrent, which means maybe they have tried to do something before and they keep coming back. So what I would recommend from Neolife would be garlic allium complex, which we know is an antimicrobial, to take it on an ongoing basis so that it can help in fighting the microbes that are causing the boils. We also recommend vitamin A plus D, which is a pair of vitamins that tend to be good for supporting skin health. I also recommend carotenoid complex to help the immunity. And you can clean the area around the carbuncles or the boils with care solution, just to make sure that the infection does not spread further. You don't have to clean your whole body with care, because remember we said we've got friendly bacteria that also occur on our skins. So keep the cleaning to the area just around the boils or the cluster of boils. Next question, someone wanted to know how to take the detox products. And here, some of the, depending on your market, you may have some of the products or not. As you know, acidophilus has been removed from, I think, all the African regions. So currently what we are using for detox products will be stage 6, Betagard, garlic allium complex, multimineral, and fiber tablets. So the things to do when you're having a detox, the first recommendation is to drink plenty of water, because remember, all of the detox will be taking place in solution. You need to be well hydrated. You also can have a diet that is higher in vegetables, can be steamed vegetables, and low sugar fruits on day 1 and 2, so that we have got a 4-day, this is a 4-day detox, sorry. So on day 1 and 2, we recommend drinking plenty of water. You can eat mainly vegetables, steamed vegetables, and low sugar fruits. Then in the morning, you take stage 6, Betagard, garlic allium complex, and multimineral. So that is in the morning according to the dosage on the container. In the evening, it will be stage 6 again, Betagard and garlic allium. So those will be the first 2 days. You'll take the supplements in the morning and in the evening. On the 3rd and 4th day, you'll only take the detox products in the in the morning. So you'll take Beta-Guard multimineral, fiber tablets, and garlic. So you'll take on the morning of the third day and the morning of the fourth day. So just be aware that your stools might be a bit loose because of the use of stage 6 and the high fiber coming from your veggies and your fruit. So that is what I would recommend for your detox. And remember that we can keep the products and use them for a detox on another cycle. So let us say you decide to do a detox now in April. You can keep the remainder of your detox supplements for further down the line, maybe at the end of the year. If they are not expired, you can even use them in the following year. Then we have the next question was about multiple sclerosis. This is an autoimmune condition where the immune system attacks the fatty covering that is found on our nerve fibers. So this multiple sclerosis has got no cure, as with all autoimmune conditions. What we need to do with autoimmune conditions is always to support our gut health, and in this way reconstitute the integrity of the lining of our gut, and that way the immune system is going to be able to calm down and stop overreacting. So the first point there on the lifestyle side will be to support your gut health. We have got a separate topic where we normally talk about gut health, so maybe if you want to know more about that, it will be in that session. Eliminate all junk and unhealthy food. Things like sugar, gluten, tobacco, cannabis, all these types of alcohol should be kept at a minimum because the body will already be quite inflamed and struggling. There is no need to add these inflammatory foods to the system. We also recommend a healthy diet, mainly made of minimally processed foods. And this is very important when you're living with multiple sclerosis. You should have plenty of leafy vegetables, steamed, and this helps to reduce the likelihood of constipation. So constipation also tends to be a problem with multiple sclerosis. So ensure that your diet contains that. If you're not used to taking a high amount of fiber in your diet, start little by little, maybe just a bit of veggies and build up as you go. If you take a lot, because sometimes people get excited and they take a large amount of something which is good for them, but because the system is unused to it, it may worsen the problem in the short term. So if you're not used to eating vegetables and other fibrous foods, do start slowly. And also don't go for the heavy duty type of fibers like beans and maize. Start with leafy vegetables and some of these fruits like avocado, apples, and so on. And then as your system gets more used to it, you can increase this. Regular exercise is also recommended, as well as resolving or eliminating stressors, which tends to make multiple sclerosis worse. Try to keep cool during hot weather, and also keep well hydrated. The supplements that we recommend for multiple sclerosis are vitamin A plus D, vitamin B complex, and CalMag. And of course, because of immune system issues, you can also add omega-3 salmon oil to help with resolving the inflammation that accompanies all autoimmune issues. And that next question was about someone who was having a uterine infection. My first recommendation for an infection in the uterus is to consult your doctor so that you can get antibiotics to kill the infecting agent, maybe bacteria or whatever it might be. In this case, I would also suggest that the spouse or the partner should also take the medication to prevent reinfection, because this uterine infection can contribute to reduced fertility in women. So both the person who is asking the question and their partner should be on antibiotics. If the condition is chronic, then of course we recommend garlic allium complex, recommend vitamin C, as well as Pro-Vitality. Okay, so that is for uterine infections, because remember, infections usually are coming from microbes from outside our body. So what we need to do is to be able to fight them. But first and foremost, with the availability of antibiotics, it gives us an opportunity to kill the infecting agent. Then next was someone who was having back problems with the discs in their spinal column. And recommendation there on the lifestyle is to avoid prolonged sitting. It's very bad for the back. We also recommend a visit to a chiropractor. Chiropractors specialize in spinal alignment. This is their specialty, and they can be able to assist if the discs are going out of place. If you do not have a chiropractor in your area, because sometimes there are not so very many, you may try to see a physiotherapist. Then the supplements that will assist in restoring the disc will be full motion to help with rebuilding the cartilage, omega-3 salmon oil to help to resolve the swelling and inflammation, and then also CalMag, which supports bone and skeletal health. Then a question about someone living with HIV, what we would recommend. This, first of all, on the lifestyle side, we recommend that they follow a rich and nutritious supplement, usually because of the struggles with the immune system. They really need to make sure that their food intake is adequate, a minimum of about 2,000 calories. Is it kilocalories? I always get confused with the with the units, but make sure that you're taking enough food. And due to the weakened immune system, also minimize your toxin load. So you need to avoid junk food and processed foods and foods that trigger some of the health issues that accompany HIV, like skin rashes, like a running stomach, and so on. So just keep an eye on which foods tend to cause you to break out in issues and avoid those foods. Then on the Neolife side, we recommend phytodefense to help the body to fight. So phytodefense is very good for our immune system and for this very serious illness. And then we also recommend vitamin A plus D together with enough sun exposure. And we recommend also chelated zinc for people living with HIV. So phytodefense, A plus D, and chelated zinc. Next question was throat cancer. The person wanted to know what we can recommend if they are going to undergo chemo or if they decide not to undergo chemo. If they're going to go without chemo, then we recommend that they increase the dose of the supplements we recommend, maybe double it or even triple it. And this would be phytodefense, 3NN, omega-3 salmon oil, and Neolife shake. So those would be, they would double the dose for that if they're not going to undergo chemo. If they're going to undergo chemo, then they can take the regular dose of phytodefense 3NN, omega-3 salmon oil, and Neolife shake. Neolife shake will be especially important if they're undergoing chemo because of the nausea and some of the other issues that are linked to chemotherapy. So moving on to a question about epilepsy in a young child. And here the lifestyle points we recommend will be a ketogenic diet. A ketogenic diet is a diet that is rich in fat, but very low in carbohydrates and medium in proteins. So these are people we will recommend to eat fatty foods such as avocado, such as fatty cuts of meat, fatty fish, and so on. And they keep to a very minimum carbohydrates, and they should choose carbohydrates which are not processed. So the small amount of carbohydrates they should eat would be things like vegetables and other wholesome foods. And then they'll take, because it's a growing child, they'll need a good amount of protein. But the idea here is some people, especially who have epilepsy, do better without sugar and carbohydrates as their main fuel for energy. They do better with fat. And that is why we recommend this. It has always been used as a way to deal with epilepsy, especially in children. And it is quite a good intervention for those types of epilepsy that do not respond well to medication. Then also another recommendation is to limit the amount of time that they spend watching screens like TV or telephones and so on, because some of those screen movements can actually contribute to seizures in some cases. So from Neolife, we recommend for a young child, mind enhancement formula. We recommend vitamin E and Vita Squares. Then for a youth or an adult, we recommend Mind Enhancement Formula, vitamin E or wheat germ oil, and Pro-Vitality. Wheat germ oil is also good for children, but the capsule is quite large. So I think vitamin E will probably be an easier one to swallow for a young child. But for an adult, they can choose between vitamin E or wheat germ oil. Remember, I think I've mentioned on various occasions that wheat germ oil is rich in vitamin E as well. Then, in addition to that, for the youth, we recommend Pro-Vitality as a general supplement. Next question was for an elderly person, 70 years old, who is having swelling throughout the body, shortness of breath, and anemia. So the first thing, of course, is to consult a doctor to identify if there is an underlying condition. It could be that their hearts are failing, no longer strong enough, because as you can see, is an older person, or it could also be their kidneys are not working very well. Shortness of breath can be due to the anemia, because when there is low blood, which is anemia, the blood count is low, it can contribute to that shortness of breath. Also, a failing heart can also be contributing to the shortness of breath. So those signs, for the person who sent the question, all those symptoms are probably linked together. And that is why I recommend you try to find what is the underlying condition, which is the root of those symptoms. Then from a Neolife side, we recommend multimineral alfalfa. We recommend coenzyme Q10 to help the heart, and then omega-3 salmon oil and vitamin B complex. So there, the attempt is to try to to boost their blood and also their heart issues or kidney issues in case they have that. So multimineral, CoQ10, omega-3 salmon oil, and B complex. Next question was about someone wanted to know what to recommend for hemorrhoids. So hemorrhoids are usually the result of chronic prolonged constipation. And so the first thing, of course, is to resolve constipation so that the root of the problem is dealt with. Opt for a diet that is rich in soluble fibers, so things like cooked leafy vegetables, different types of fruits, and so on. Include gentle exercise and activity in your daily routine, because exercise does help to ease the bowel movements. And then, because by the time you have hemorrhoids already, there are a number of problem issues there. It may be a good idea to see a doctor to get suppositories to help with the hemorrhoids, so that they don't keep popping out when you're straining to pass stools. So stage 6 is going to be helpful for hemorrhoids. Fiber tablets to supplement your dietary fiber, and also chelated zinc to help with the healing process of the hemorrhoid. So the lifestyle points there are very important, because if you continue to be constipated, it will be difficult for the hemorrhoids to heal. Unfortunately, in some cases, surgery may be needed. So you can discuss that with your doctor depending on how severe the issue has become. Next question was typhoid. So typhoid is another infection. So the first thing is to consult your doctor in order to get antibiotics to deal with the microbe that is causing the infection. And then from the Neolife side, we recommend Neolife Shake, because typhoid can be accompanied by diarrhea, and your nutritional status may be quite low. So Neolife Shake will help there with both the diet as well as with rebuilding your body. We also recommend multimineral alfalfa to support against the loss of metabolites, so through the diarrhea. And we recommend garlic allium complex as well. So for typhoid, those 3: Neolife Shake, multimineral alfalfa, and garlic allium complex. Next question was for an enlarged prostate. So the prostate is a gland found within the reproductive system of gentlemen. And here we recommend on the lifestyle to increase activity and exercise for prostate health, and also to opt for a healthy diet. Then we recommend highly for prostate health and large prostates, Cruciferous Plus, very important and very effective. We also recommend herbal masculine complex and chelated zinc. So those are the recommendations for the prostate issue. Then the next question, there were a group of them. One was for tremors as a result of Parkinson's disease, and the other was for a dementia, which they did not specify. So the best that can be done with these illnesses is to slow down the progress of illness. So we cannot reverse Parkinson's disease, but we can slow down the rate at which the disease is developing. And what we recommend there will be coenzyme Q10, recommend omega-3 salmon oil and vitamin B complex. It may be important to add to the diet plenty of fiber, because some of the issues could involve chronic constipation. So in the lifestyle side, I didn't mention, make sure you clean up the diet. Research is showing a close link between different types of dementia and sugar issues. So I would say that someone with any form of dementia or Parkinson's disease should follow a similar diet to what someone with type 2 diabetes would be following, because of the link between sugar issues and the different forms of dementia. Then next question was one which I will answer lightly, because it is also a large topic that we'll have as a standalone, and this was obesity. So the first thing to say about obesity is that there is no one system that works for everyone. So you may have to try different types of things, different types of diets and ways of approaching your eating to see which one you find tolerable and effective, because you need to use a system that you will stick to. Also, just to make another point, that it is losing weight seems to be easier than maintaining the goal weight. So you need to follow a system which you are going to make into a permanent lifestyle. If you use a system a temporary system to lose weight, you may be able to lose weight, but as soon as you go to your old ways, then the weight is going to come back. So an important aspect of dealing with obesity is to trial and error to find a system of eating that you can sustain in the long term, so that even if you are losing weight slowly, you are able to sustain those habits. So some of the things that you can try is time-restricted eating, which is to select a period of during the day, some hours during the day, during which you eat, and then you don't eat outside of those hours. So you can say you can eat from 8 maybe to 6 o'clock in the evening, or whatever works for you. This way you give your body a break from digesting and dealing with food. And when you are not in a fed state, it gives the body an opportunity to release fats and burn them. So time-restricted eating works for some people. Eliminate sugar and all kinds of junk food that you may be contributing to the issue. Things like sugar really have got, once you are obese, you have got to abandon them, unfortunately. Deep fried foods, fast foods, processed foods, all these contain chemicals and are made in ways that contribute to unhealthy weight gain. Then opt rather for minimally processed foods, and these will be foods that are high in fiber because they are more in their natural state. And then if you are taking meat, then you can make sure that it's not processed meats, which have got issues of their own. Then after your main meal, take a short walk. This is to help you to become more sensitive to the state of fullness, and it might also be helpful in avoiding overeating or large portion eating, because if you once you've finished eating, to avoid the temptation to go and get second and third helpings, maybe going for a walk could be something that you find useful. So those are some of the points that I can recommend as a way to start. And as I've said, there is no one system that works for everyone, because each of us is unique, and you may find that a system that worked for someone else does not work for you. But do not give up. Keep on trying to see how you can shift things around until you find what works. We recommend to make sure that as you are changing your eating habits, to lose weight, that you take Pro-Vitality to ensure that you're getting all the nutrients that you need. Because one of the reasons why you might be overeating, if you are that is the issue, would be that your body is looking for certain nutrients that it is not getting. So Pro-Vitality is a good general supplement. You can opt to replace one of your meals with Neolife Shake, which is a good or all-round meal in itself. And then you can also add to that Amitone. So Amitone helps you not to lose muscle. Remember, you need muscle because muscle helps in burning fat. So Pro-Vitality, Neolife Shake, and Amitone would be our recommendation there. Together with, of course, a certain amount of exercise or activity. When you are still very heavy, you need to do gentle exercise in order to safeguard your joints, which if you do vigorous activity when you're still heavy, it can be quite damaging to the joints. Next was someone wanted to know what to take after fibroid surgery or what to recommend after fibroid surgery, the removal of fibroids. And here on the lifestyle side, opt for nutritious, minimally processed foods, as I'm always recommending, and eliminate or minimize factory fats. Those are fats that are made in factories from plants which normally do not produce any significant amount of fat. Opt rather for healthier fats, things like avocado, coconut oil, olive oil, ghee. All these are better fats for a person who has had fibroids, because new fibroids can grow. So do take the lifestyle points to avoid recurrence. Products that you will use for fibroids will be Cruciferous Plus, chelated zinc, and omega-3 salmon oil. Fibroids are another condition that is linked to sugar metabolism, so you may want to have your sugar checked. And if there's an issue there, you add botanical balance to the recommendation. So Cruciferous Plus, chelated zinc, omega-3 salmon oil, and then if you have sugar issues, add botanical balance. Hypertension is the next question, high blood pressure or hypertension. So here our lifestyle points will be eliminate the usual problem foods, sugar, factory fats, junk food, etc. We also recommend that you opt for healthy fats and healthy food, and then include exercise and activity in your daily routine, because you need to exercise your heart. If you are not used to exercising, start slowly, maybe just by walking around the block, and build up as time goes. The supplement for hypertension will be lipotropic adjunct for your blood health. We recommend omega-3 salmon oil to reduce inflammation and clean up your blood vessels. We also recommend garlic allium complex and magnesium complex. So those are the recommendations for high blood pressure or hypertension. Next question was someone who wanted to know what to recommend for recurrent urinary tract infections. The person says they're using the person is using intrauterine devices for contraception, and they also have varicose veins. So just to say that intrauterine devices can be very problematic for women. Possibly discuss with the gynecologist alternatives. And because this could be that your body is simply rejecting this and it is becoming a source of injury to your system. And remember, this can be one of the ways in which fertility becomes compromised. So the Neolife products that we recommend here will be BetaGuard. We recommend flavonoid complex, and we also recommend garlic allium complex for urinary tract infections, recurrent ones. So continue taking this. For short-term relief, you can use citrus soda. It's called citrus soda here, but I don't know what you call it in other markets. You can check with your pharmacist what they call it. This gives temporary relief, but it's not a permanent cure. So use a supplement. But to ease the immediate discomfort, you can use citrus soda. It's preparation with crystals that helps to ease the issue a little bit. Next question was what to recommend for someone who has had their breast removed because of breast cancer. So the first thing, of course, is if they have had chemotherapy and finished doing the chemo, then we recommend they use Betagard. And then the recommendations here will be Cruciferous Plus. We recommend omega-3 salmon oil and vitamin A plus D. So that is supplements to use after a mastectomy or the removal of a breast as a result of breast cancer. And then, of course, they can also continue, if they had been using phytodefense, they can continue using phytodefense also, because you do know that the cancers may come back. So it's good once the treatment has occurred to continue with the phytodefense as a way to assist your body in ensuring that you don't have metastasis or that the cancer comes back. Okay, next, someone wanted to know, someone was asking for recordings of the sessions. I'm not sure which sessions they wanted exactly, but you can discuss, message Pascal or discuss with him which recording you wanted. Sometimes we record from our side, sometimes Cynthia might be the one recording, so just find out. The numbers are usually, Pascal's number will usually be available at the DSC. Next question was about cataracts. So this is a condition where you start getting blurry vision due to the lenses in the eyes becoming cloudy. This can be, usually it tends to be a matter of age, but it can be hastened by diabetes. So once again, we see diabetes causing issues with eyesight. So again, if you have cataracts, be cautious about your diet, and just in case that is contributing to the problem, use excellent recommendation, carotenoid complex, vitamin A plus D, and omega-3 salmon oil for cataracts. And this you can immediately start using. And if you between your doctor and yourself, you decide to go on with having cataract surgery, you may do so. But I think that the supplements will play a very good role there. Next question was about short sight or myopia, another eye issue. And once the myopia has been established, it is difficult to reverse it. So in children, if you have children, you can actually prevent them from becoming myopic by ensuring that they get time out playing outside, where their eyes can change focus in different ways, looking far and looking close. And that way, also in the classroom, they may tend to sit towards the back of the class so that their eyes get used to looking far and looking close. One thing that contributes to short sight is spending a lot of time looking closely at screens or at books, so that the lens tends to be in just one state rather than relaxing by changing focus. So for an adult, we may not really be able to do much about the myopia itself, but of course we can also look at the supplements that will help in general eye health. So just to say there, sun exposure, very good, and frequently relaxing your lenses by changing the focus of your eyes as you're working. And the supplements we recommend will be, once again, for eye health will be carotenoid complex, vitamin A plus D, and omega-3 salmon oil. Another question was how to protect muscle and bones. As you probably will be aware, as we get older, our muscles can start diminishing and our bones can become thinner and brittle and more delicate. So it is actually a good thing to do exercises that support the skeletal health. This will be exercises carrying weights, things like jumping ropes, or trampoline, or using dumbbell for exercising are good, especially as we get older, but at all ages, I would say, but especially if you want to maintain muscle and bone strength. Make sure that you do these types of exercises and overall maintain an active lifestyle. With Neolife, we can recommend Neolife Shake, we recommend Calmag, and we also recommend Amitone. Then another question was what to recommend for pollen allergy. So here, on the lifestyle side, certain types of people have got very a strong tendency towards allergies. So some of the things you can do as the pollen season comes in, apply Vaseline on the eyelashes to prevent the pollen from getting into the eye and irritating it. At the end of the day, you can rinse the eyes and the nostrils to remove the pollen. And then the supplements that we'll use to help the body relax from this allergic reaction is flavonoid complex, omega-3 salmon oil, and herbal respiratory complex, especially if the allergy is causing you to have coughing and running nose, then herbal respiratory complex will help with that. The question was about the problems in the spleen. So the spleen is a small organ that is used to store and manufacture blood. So my first recommendation is to see your doctor to establish if there's an underlying condition that is causing the spleen issue. An illness like sickle cell anemia actually is linked to spleen problem. Illnesses like leukemia also, and also if you have liver problems, it can extend into the spleen. So have that checked. And then the supplements we recommend for the spleen will be multimineral alfalfa, recommend vitamin B complex, and chelated zinc. Then now as we are moving towards the finishing, okay, I had another question. I think this one I'd answered, a child with epilepsy. The last question is ulcerative colitis. So this is a variation of the irritable bowel syndrome, and it mainly affects the colon, that is the large intestine, and the rectum, that is a part of the intestines just before the anus. It is important to deal with this and resolve it because it increases the risk for colon cancer, which is one of the cancers that's becoming very common in Africa. So it's a good question to have asked because you need to take the steps to deal with ulcerative colitis. That means that ulcers are forming in the colon. The first thing is to opt for a healthy diet rich in soluble fiber. The colon is one of the places where the friendly microbes in our gut live. And the friendly microbes, as I've said on other occasions, they live on fiber. So ensure that you've got a healthy diet that is rich in soluble fiber. The reason we say soluble fiber is that it's easier to digest. You can steam your vegetables. You can cook them. If you are eating something like beans, make sure that you soak them overnight and you cook them thoroughly so that they are easier to digest. If you find it difficult to digest them, then opt for easier options like cabbage, spinach, and so on. Avoid problematic foods. If you tend to be sensitive to wheat, opt for other types of grain. There are many other grains. You can eliminate wheat from your diet altogether without any detriment. Opt for things like arrowroots, things like cassava. All these are good starches that can replace gluten. If you're sensitive to dairy, avoid that also. And then, of course, eliminate junk food from your diet altogether. Then, to help with healing of this ulcerative colitis, we recommend chelated zinc. We recommend omega-3 salmon oil. You can add fiber tablets if you are not getting enough fiber from your diet, or you are struggling with your dietary fiber. You can start with maybe just one tablet of fiber tablets as you build up with time. And then you can also use aloe vera plus, which soothes the system and can make things more comfortable in your gut. Okay, so here we are at the end of our questions for today. I want to thank you very much for having spent this time. And I also want to take this opportunity to wish you a very blessed Easter weekend, the Holy Week and the Easter weekend. I hope, I know that during this time we have got all the Abrahamic religions, the Christians, the Muslims, and the Jewish people are having this religious holiday. So I wish you all the blessings during them. And even if you may not be a believer in this, I still wish you many good things in the 2 weeks that we are not going to see you. May all be well with you. And as you know, in our business, we never need to stop. We can still find people who are in need, and we can find ways in which to help them. So thank you very much. And here is Pascal now to take you through the next session. Good night.